brain cancer is a difficult diagnosis for anyone to come to terms with. The complexity and stress of dealing with the healthcare system can take a heavy toll on patients and their families. Thanks to your donations, the Mark Hughes Foundation provides a brain cancer care coordinator just to make that journey a little easier for those affected.
My background's oncology nursing, so I've been an oncology nurse for the past 6 years, which has always been my absolute passion, is caring for people with cancer. There was no scope for a brain cancer care coordinator within the Hunter New England Health area until the Mark Hughes Foundation came along and they completely fund my role. What makes the foundation so special is a sense of hope, really. I think that before the foundation came along, patients were really left in the dark, and without a care coordinator, their journey was incredibly difficult. These patients are diagnosed with a tumour. They then have countless follow-up appointments to see maybe a neurosurgeon, a neurologist, a medical oncologist, a radiation oncologist. It was incredibly difficult and stressful, and it actually makes me really sad to think that these patients are doing it on their own beforehand. From person to person, family to family, everyone reacts differently, and I find it really intriguing to see how people do respond to being told that they've just been diagnosed with a brain cancer. Some people want to know as much as possible and want every single little detail about what's to come, about treatment and post-treatment care and referrals. Other patients just want to know the absolute minimum and just want to know what's just going to get them through today. The average survival for a patient diagnosed with a glioblastoma is 15 months with treatment. Only 5% of patients are alive 5 years after diagnosis. And the statistics of survival really have not changed for 30 years. The statistics are not good enough, and hence why the Mark Hughes Foundation is doing all this work to find better treatments. I see a patient, who's just been told he has brain cancer. He's being resilient in front of his family. He doesn't want to upset his wife, and he's being strong and just says, okay, what next? And then when the doors are shut and it's just him and I, that's when, the truth will come out about how obviously devastated he is, but he's trying to be strong for his family. And to me, that is just the ultimate act of love and protection for your family, because every day I just see these family members trying to protect each other from the absolute devastation of this diagnosis. The human spirit is just an amazing thing. I think that these patients and their carers are so resilient, and it's a privilege to watch that every day. I think I look at things a lot differently because I see how things can change so quickly over the space of a week or a day, or even a minute, being told that you have brain cancer. And I don't think many people in life have that opportunity to actually appreciate life itself and how quickly things can change. So in that regard, I feel incredibly lucky to be on this journey with patients and their families, because it's changed my life for the better. What the Mark Hughes Foundation has changed is really awareness. I think that getting people, families, communities talking about this disease is going to bring about more funding, which is what we need to find a cure.